In today's prehab video, we're going to take a look at a couple places in the lower leg that might be causing some of your lower leg pain. These things could be leading to soreness in your calves or your shins or in the bottom of your foot, like plantar fasciitis. Even if you're not having any pain in these places, but you've recently increased your volume or your intensity while running, you may want to just check out these places anyway, just to prevent future injuries from happening. The first place that we're going to take a look at would be a muscle known as the tibialis anterior, which is located just right off to the side of your shin. What I would like you to do is to begin by finding that muscle located right here. If you're not sure if you're on the right spot, you can just move your foot up and down, and you can see that that muscle is getting bigger. You might even feel it moving underneath your fingers. So what I'd like you to do then is to take your fingers and kind of hook into that. You can do it like this, or you can even take your thumbs and do it this way. Press into that muscle and pump your foot up and down, just like as if you were on a gas pedal. Work your way down, and if you find a spot that feels tender, then spend a little bit more time there. You can also move your foot in circles as well. Either way works just fine. Continue to work all the way down along the tendon as you get closer to the ankle. The second muscle that we're going to take a look at is on the other side of the shin. Finding the edge of that shin bone, go right on the inside of that. That muscle is known as the posterior tibialis. Again, taking your thumbs, hook in behind that shin bone and press in. Then move your foot in circles or pump your foot up and down. Work your way down, and if you find a place that is sore or tender, spend a little more time in that area. This is something that you could do when you're just sitting in class or at work, or if you're riding along in the car. I don't recommend doing this while you're driving. All right, so those are two places to check, here and here. The next place we're going to look at is at the bottom of the foot. This muscle right here, the tibialis anterior, comes down and attaches underneath the foot, right there. What I'd like you to do is take your finger, or you can hook in with your thumbs, either one, and feel right where the edge of that bone stops, kind of where it falls off a little bit of a shelf. Feel around in there. If you find something tender, just, again, pump your toes here up and down. Not your ankle, just your toes. If you feel something tender, spend a little more time there. The second place to look at would be over here, behind the small toe or the fifth digit. Similarly, feel where the bone ends, where it kind of falls off the shelf. Place your fingers in there, press in, and pump your toes up and down. Feel around. If you feel anything that's tender, sore, crunchy, spend a little time there until it works itself out. The last thing you can do is to see how mobile your toes are. When you push one toe, does it stick to the other toe next to it? What you want is to have good mobility with those toes moving freely. If you do happen to get to a place where it feels like two toes might want to move together, or where there's not a lot of range of motion, what you would do then is take your fingers and push them in between the space between the bones. Do that from the bottom and also from the top, using sort of a pinch a C shape. Hold that, and then move your toes back and forth until that place starts to loosen up and the toes begin to move more freely. All right, so just to review, check this muscle here, this muscle here, by pressing in and moving the foot up and down or in circles. Underneath the foot, check here and here. Press in and move the toes up and down. Also, check in between the toes, and if there's a space between the two toes, press into it and move the toes up and down. All right, thank you for listening, and I hope that that helps you get over any injuries that you might currently have or to prevent any in the future. Thanks.